good afternoon, good morning, and good evening to everyone watching us today. It's time for Africa, and today we have an amazing presenter that is going to share lots of insights on neonatal respiratory care. But before I start, kindly note that this webinar is brought to us by the Africa Respiratory Care Association. And Africa Respiratory Care Association, our mission is to reduce the burden of disease by strengthening respiratory care workforce and providing opportunities for professional growth, thereby promoting innovative solutions to improve respiratory care. This webinar is proudly sponsored by Zopec Medical. Zopec Medical is a medical device company that produces the world's smallest and lightest UPS batteries designed for critical care, transport, and emergency backup. This UPS technology enhances safety and continuum of care away from bedside while providing ideal respiratory care with heat and humidity during critical care transport and mobility. You can visit them on their website at www.zopec.com. So www.zopec.com. And connecting that to our presenter, she is bringing a wealth of knowledge from Somalia to our webinar today. Her webinar titled Saving Little Breath will focus on raising awareness, advocacy, and action for newborn respiratory care, highlighting um, the critical importance of neonatal health. She is Dr. Ikran Abdul, the CEO and founder of the Global Health Alliance, a non-profit organization dedicated to improving maternal, newborn, and child health in Somalia, Africa, and the world at large. She is passionate about strengthening healthcare system, empowering frontline providers, and fostering global partnership to address critical health and challenges. Dr. Abdul is a family nurse practitioner and a member of the American Association of Nurse Practitioners and Minnesota Nurse Association. She has been a nurse for the past 20 years and recently earned her doctorate from Augsburg University in Minnesota, USA. She has dedicated her time to serving Minneapolis, that is in Minnesota, marginalized and underserved communities here in the USA. She participated in medical mission trip to West Africa, delivering vital supplies and medications and education material, also to the Eastern Africa, which is especially Somalia. Dr. Akran's diverse experience in medicine is what drives her passion to serving communities that are in need. Her vision is to eliminate global health care inequalities, sorry. So today we present to you Dr. Ikran Abdul. Dr. Abdul, your audience, our presenter. Thank you.
Beautiful. Can you guys hear me?
Yes, we can hear you.
Beautiful. Sounds good. Thank you, Madam President, for that warm introduction. And I would like to say thank you and welcome everyone and to this beautiful foundation of webinars, and hopefully we'll be enjoying for a good listening and learning together about what is the meaning of saving little babies and saving little breaths and how important this is all to us and to helping our countries. So again, welcome. And without further ado, I would like to go right into it. So I am a little bit sometimes challenged in technology, so I will try to do the best I can to kind of navigate, but let me share my screen here so we can get right into it. Give me one second. Let's see here. Okay, can you see my screen, you guys?
Perfect, we can see it.
Yes, we can see.
Okay, beautiful. Okay, again, thank you and welcome. And my name is Dr. Ikran Abdullah, and I'm one of the founders and the CEO of Global Health Alliance. And here today to present saving little breaths and respiratory care. So again, a great opportunity for ARCA and Global Health Alliance to collaborate and to be able to bring this training to for you guys. So looking forward to it here. So let's get into the objections. So this is our objectives tonight that we're going to be covering, hopefully by the end of the presentation today. So what are our objectives? To increase understanding of importance of early respiratory health and interventions for infants and children across Africa and beyond. To educate healthcare providers, parents, and caregivers. Foster collaboration among respiratory care practitioners. Showcase the evidence-based practices, and to advocate for stronger health policies to increase an investment in respiratory care, targeting children and inequitable access to a life-saving cares to our whole humanity. Let me get in there. Sorry about that. Okay. All right. So if we look into the world view, if you look at the whole, before we dive into the specific Africa or to Somalia, if we take a look at the world view of respiratory care, what does that look in the eyes of the global health? Global disparities, honestly, if you look at it, the infant mortalities, and if you look at the under five mortality, global disparity emphasizes the access of neonatal respiratory caregivers or caregivers are variously are discarded or are like drastically different when you look at it, the well-developed countries and underdeveloped countries. While high-income countries have advanced technology and trained staff, when you compare it to the low-resource nations who lack of the skilled, essential equipment and expertise when it comes to respiratory, or even having a vast understanding of respiratory care and the importance of it in our healthcare world. What are the global burdens for neonates? When you kind of take a deep dive into it and look at it, how is this looks into the neonatal mortality in our children? Having limited access to quality neonatal care service, including trained healthcare providers and equipments. Also having a high rate of preterm birth, low birth weights, birth excess fear when you look at it, contributing to the fact of neonatal deaths. Infections such as sepsis, pneumonia, neonatal tetanus remains to be to this day the major causes of major mortalities. Inequitable distribution of healthcare resources, which with the highest burden seen in low to middle income countries, particularly in sub-Saharan African and South Asia. Continuing looking at the world or looking at the specifically to Africa. When you look at it from north to south, east to west, newborns face similar challenges across limited resources, gaps in healthcare access, and growing need for stronger respiratory care support is absolutely needed as you look through the whole region from top to bottom. If we take a dive into the actual why does this matter? If we come down to particularly in Somalia, where I'm from, and where we do a lot of teaching and a lot of healthcare training programs, according to the WHO and UNICEF, the Global Health Data Exchange in 2022 to 2023 statistics have shown sub-Saharan African continues to have the world highest neonatal mortality rates, with the respiratory complications as the leading cause for that. Look at the statistics here. The newborn deaths remained concentrated in Africa. In 2023, 26 out of 1,000 live births were for the neonatal in that low income countries when you look at it compared to the high Western or developed countries. Somalia is actually when you look at it compared to the regions, Somalia seems to be one of the highest mortality rate, and it's 36 out of 1,000 live births. Again, this is why it matters. And the key takeaway for this is that respiratory care is central, absolutely central, vital of hitting newborn survival rates or survival targets. When you look at preterm or look at the prevalence, preterm, hidden hypoxia, urban and rural divides typically between the rural and hospital reports highest untreated cases due to limited oxygen and resources and equipment, given that how inner cities are away from the hospital settings. When you look at the detection gaps, facilities that have better oxygen and trained staffs seems to report some better cases compared to other rural hospitals or people or hospitals that do not have the accessibility or the equipment or the trained providers that can't attend to some of these respiratory distresses that people come in for or notices in preterm children. All right, what do our newborn children face? These are the common respiratory conditions, RD, especially in the preterms: transient tachypneas, meconium aspiration, pneumonia, and apnea prematurity. Let's look at the clinical realities. Timing really does matter. The newborn deaths occur within the first 24 hours of the first week of this newborn, according to WHO and UNICEF. Most deaths are preventable, absolutely preventable, with proven interventions like oxygen and simple like CPAP. Respiratory care in Africa, if we look at it, what can we do? According to WHO and UNICEF, again, 2023 was reported on the data 2023, 2024 was reported fewer than 60% of the hospitals in sub-Saharan Africa has had reliable oxygen or pulse oximetry to support the survival of the newborns. Limited training workforce. Again, we're noticing that it's coming back and forth. Also inadequate infrastructure equipment and equipment, not having enough support, whether it's infrastructure or whether having the actual support that can fit that infrastructure. We continue to have seeing weak policies, absence of national policies and recognition or standardized respiratory therapy or having a distinct healthcare professions for this respiratory care profession. Low in public and professional awareness. Both general and many other healthcare workers are not familiar the role of respiratory care or the importance of the role of the respiratory care. And it is being underutilized currently. And hopefully this is one that ARCA and Global Health Alliance's major goal is to change that. The CPAP and surfactant access. This is another critical area that we are lacking. CPAP availability is about 63%. It's according to WHO, again, 63% of the top tier government hospitals have access to that. And 33 to 39% has surfactant available. Somalia, if you look at it, Somalia, again, in a snapshot, 1 out of 4 facilities have uninterrupted electricity. This is one of the major campaigns that WHO has deployed it in that region to be able to provide a solar power oxygen in thousands of pulse oximetries in hopes to combat the neonatal respiratory distresses are being seen in Somalia currently. Neonatal resuscitation training. Why is this really important and why is it matter to save lives? Having a simple trainings and having the helping baby breathe, which have been one of the trainings that Global Health Alliance have also been doing in Somalia in the last year or so, have really shown and proven method of reducing the infant mortality rate. If you look at in Tanzania, there's a report that resulted in nearly 47% reduction on early neonatal mortality, shows in fewer fresh stillbirth implementation because of the trainings that have been done and have been implemented. They've seen this big reduction. And imagine if we combine that with respiratory therapy and respiratory therapy professions, how much we can further bring that number. These are the respiratory expanding the access of the newborn. What do we need? A minimal bundle for district hospitals and high volume healthcare centers should have the following systems available to them at any given time. Simple, having a bubble CPAC, what impacts does it have? Again, here's another report and statistics 2023 that was taken. It's up to 27 to 50% reduction of simply introducing or introduction of CPAP or a bubble CPAP to introduce to a newborn to save their lives. What were some of the barriers that we've seen? Again, maintenance, having a staff chain, gaps being one of the biggest struggle that we've seen across the continent. We've seen over and over early CPAP use in facilities without even without surfactant or mechanical ventilators. Just simply introducing and doing the training for this early CPAP have saved major lives and major difference have been noticed in the region. So even if that is the little thing that we can do, is to be able to teach and have access of using CPAP. Policies and systems, excuse me. Building the workforce. Again, having respiratory therapy being part of the professional medical providers or medical healthcare providers is essential. Having nurses and physicians to perform the respiratory care duties, especially in due to shortages, or having them in place of the RTs. We are seeing a lot of physicians being pulled into that, where we could have a simple respiratory therapist or access to respiratory therapy professions could be the key of taking those roles and having and freeing those providers to attend for other healthcare or clinically need patients for. The urgent of need for formal RT education is really important. For strengthening the systems, how can we look at that? National oxygen pulse oximetry plans, establishing clear standards, connecting with our partners, making sure that we have pulse oximeters available, integrating or looking into the impact of integrating, making the oxygen and pulse oximetry as a bundle for newborn or maternal child hospitals or stand MCHs, making sure that they have availability to those resources and having that, and making sure that we have a way of tracking those. What are the percentages that we're seeing? What are the improves? Where do we need to target? So having the systems in place would also be able to put us in a better come out in a better way of saving our neonatals and making sure that we're not our numbers are not just heading towards down and actually coming back up and being part of the really mainstream for that. I'm sorry, excuse me, why Africa needs respiratory therapy? Why do we need that? Why is it important? Well, all the things that we've been talking about is why we need it. Is we've seen the rise and burden of respiratory diseases. We've seen high mortality, high child mortality from preventable causes, and there is the shortage, obviously, of training. So this is all the reasons why we need to be establishing a standardized respiratory therapy care across Africa. A need for specialized critical care, mechanical ventilators, airway management, and having the skill essential for saving lives and having the appropriate professions to care for them. Public health and preventative education. Respiratory therapists are the key to community outreach, education on smoking cessations, air pollution, and early recognition of respiratory symptoms. With the proper training and integration, respiratory therapists enhances our healthcare system, ensuring the readiness for pandemics, as COVID had taught us a lot, outbreaks, and respiratory emergencies. Global Health Alliance, what are we having put in place to combat and address this burden that we are seeing in our continent, especially in Somalia? Global Health Alliance mission is to improve healthcare outcomes in underserved regions through education, training, and development, beginning with the most vulnerable population, mothers and children. GHA empowers healthcare providers with cultural competent skills, innovation tools, and sustainable system to save lives and strengthen healthcare infrastructures. Our vision, we all vision as a GHA, a world where every mother and child, regardless of location, income, has access to quality, compassionate, and equitable healthcare. GHA envisions a resilient healthcare system led by trained professionals who deliver life-saving care with dignity and cultural understanding. Our aim is to bridge global health gaps by integrating critical training, technology, community-based care models, promoting collaboration among healthcare institutions, government, and nonprofit organizations to reduce maternal and child mortality worldwide. And without each other or without the other, whether it's a government, whether it's other institutions, whether it's other hospitals, we all need to work together to for our aim to become how can Africa has a better outcome for our maternal and child health. GHA works training. So what our focus is to targeting the capacity buildings of the healthcare workers, working with nurses, midwives, physicians, in an evidence-based maternal and newborn care, emphasizing the respiratory management with neonatal resection and early detection, on-site and virtual training. Thanks for technology these days, most of these trainings can be done virtually, connecting with special providers, special trained healthcare, and be able to continue to training, whether we continue the training, whether we're in person or whether we do it through virtually. System is strengthening. GHA collaborates with Ministry of Health, hospitals, NGOs to improve the oxygen system and oxygen systems, infections control, and sustainability of equipment use. Cultural competencies integration. Training emphasize respect for the local practices and patient-centered communication to ensure cultural appropriation care is delivered throughout. Implementation phase. In August of 2025, Global Health Alliance, in collaboration with ARCA and Bosaso University, we hosted a respiratory care forum in Somalia led by our country director, Jonas. The event had brought together clinicians, policymakers, and global health partners to raise awareness of this critical role of neonatal and maternal respiratory care and to promote the evidence-based training and the sustainability for the development of this program. This collaboration advanced neonatal efforts to expand and strengthen in respiratory care training and to integrate newborn respiratory care management into Somalia's healthcare system, a vital step toward improving maternal and newborn survival across the region. And here's just talking about more of the collaboration and the importance of having the stakeholders as the policymakers in the government being part of the team. Without that, it will be incredibly difficult to move forward and be able to establish the healthcare system and strengthening our healthcare system without that. And here is just some of the trainings that we've done. And as you can see on your left-hand side or the screen, a lot of the hands-on skill-based trainings that we've done for the ENC, which is the Essential Newborn Care Training, also helping mother and baby survive, as well as the respiratory care introduction that we've done, of the form that we've done in just past August, as well as the Dynamite or the medical software program that we introduced, which helps clinicians to be able to manage using evidence-based tools to manage their patient care as evidence-based as the management and diagnosis and medications, and giving them a real timely research evidence that are used in the Western or the developed countries as healthcare providers. So basically, it's using the same tools that physicians and providers are practicing in US or Europe use to be able to treat their patients. What are some of the replicable models that we can practice and continue to do the training? As I mentioned earlier, Tanzania, Ghana, and Somalia and South Africa has significantly had a reduction in their early neonatal mortality were observed for following structural, such as the Helping Babies Breathe training programs. These initiatives, which are proven by the WHO and American Academy of Pediatrics, are the essential trainings that we need in such regions in Somalia or in Africa, which it's considered the low or to middle high income countries. Doing these simple trainings continuously are way to reduce the mortality rate. And some of these numbers we've seen up to sometimes to 50% of reduction of seeing the new by just simply following these trainings have shown critically improved for the neonatal and maternal death of in African neonatal statistics. So again, I truly believe continuing these trainings and modeling these trainings would be the way to go and to continue to show that improvement in that reduction of the maternal and child health in Africa. So the implementation of the solar oxygen. This solar oxygen was recently introduced by the WHO, especially in the Somalia region, through a concentrator, which is a network kind of expanding the oxygen grid, or which Somalia and other countries struggle with power. So there's a lot of power outages or systems. So when that happens, instead of having the oxygen or the treatment being disrupted, having this solar available will be able to continue and carry through that. So in many parts of the sub-Saharan Africa, including Somalia and Malawi and Uganda, hospitals really struggle providing oxygen therapy due to the infrequency of power outages and the lack of cylinder refill. So this opportunity in the solar oxygen system will hopefully be able to eliminate some of that struggles that we see. And some of these systems have already been successful and have been piloted, like I said, Uganda and Malawi and Tanzania and Somalia, and they are being seen, being sustained and delivering the oxygen for the newborns, respiratory distress in children with pneumonia, as well as adults with hypoxemia. So there's been incredibly some improvement seen on that system and having that availability. What do we need to do to close the gap? Building a strong future for respiratory care. ARCA, it's advancing respiratory care therapy professions across Africa through education and advocacy and professional networking. GHA partners with ARCA expand access and strengthening system. Joint initiatives include public awareness campaigns, hands-on training, policy engagement, universities, Ministry of Health, all hands-on. Together, ARCA and JHA are closing the critical gaps in respiratory care and other healthcare professions as well, transforming vision into lasting impact for our newborns, patients, and families. ARCA builds RT professions through education again, joins activities including public awareness, training events, policy engagements, and universities, and continue with that message through until we come on the other side. Call to actions. Access, awareness, action. What is access? Equipment or equipping every delivery site with a newborn respiratory bundle, find spare parts, maintenance, standardized device. It's critical, as important as having the tools, having parts and maintenance or biomedical engineers, technicians to be able to troubleshoot it if there's any situations where the machines malfunction. So it's as important as it is to also invest on that aspect of human capacity. Awareness, having the scale, having the health baby breathe, early warnings, trainings for all birth attendants, community awareness, and seek early care. What is our action? Recognize, license RTs nationally. RTs educate tracks with national with neonatal rotations. Adopt national oxygen, pulse oximetries, policies, and fund operational research. What are the key takeaways? Major gaps limit respiratory care in general hospitals, low access to oxygen, unreliability of electricity. Hoping the solar power solutions will improve the access, but coverage remains to be limited. Without the bottom line, when we look at it, without a recognized RT workforce, life savings will be underused and for unsafe for our moms and babies. Okay. Thank you. And if there's any questions, I will be more than happy to take some questions for you guys.
Thank you, Dr. Ekran. Thank you so much for those insights and for letting us know the action, especially the awareness part and then the education part. We are so grateful to you for your presentation. Kindly post your questions at the Q&A button below the your screen, and then we can read your questions out. Thank you very much. Okay, so Dr. Ekran, we have some questions for you. The first question is the respiratory therapist program already established in Somalia? Um, I would like to take this question. Um, so the respiratory therapy program hasn't been formalized yet, as in the bachelor's degree program, but there are stakeholder engagement that is ongoing to ensure that this program is formalized in Somalia. So there are a lot of work behind the scene working hard to get the program formalized. Thank you very much.
I would like to add that to that. Although we have not established the respiratory therapy program, but we do a lot of neonatal resuscitation training. So that's been introduced into the healthcare providers and as far as the birth attendees and nursing.
Okay. Oh, so someone is asking, can you talk more about the battery you mentioned before the presentation began? Oh, okay. Thank you very much for that. Okay, so these batteries are produced by a company known as Zopec Medical. So Zopec Medical produces the lightest and smallest UPS battery. Maybe the IT team can project it again. Thank you very much. So this is a hospital graded battery that supports critical care mobility and transport and emergency backup. So, for example, in situations where there are power outages or you need to move your patient from one unit to another, for example, in this particular context, we are talking about neonatal care. Maybe you want to take the baby to ECG to do maybe echocardiogram or maybe an X-ray unit, or you want to move the baby from one um, room to another. There should be a continuity of care, no interruption. So this is where this technology can be backed up to the equipment that you are using to provide the care for the baby. So be it any critical care device by the patient. Now, it is also for adults care, um, ambulance transport, air transport, everything transport, anything that enhances mobility of the patient. And even in adult care, if you would want to walk the patient, because early mobility ensures and encourage faster healing of the patient and recovery. So these power systems will come in handy to still give the care that you have to give to the patient while transporting or mobilizing the patient or ambulating the patient. Thank you very much. And then we have a question from Rose Enin from Ghana. She said, regarding the solar system being used to generate oxygen, being used in countries like Tanzania, Somalia, and Malawi, are, are the solar system used for very large facilities or small ones?
For large hospitals currently being used. And there are some tests or smaller MCHs that are being talked about being utilized, but I don't have that data yet. But right now it's being utilized on the big hospital.
That we have a survey to validate respiratory therapy profession in our countries. So if you're watching from anywhere in the world, yes, obviously it's an English webinar. Kindly scan the English QR code and fill out a 5 minute survey. We want to know your thoughts on this profession or professionals in your country. Even if you don't have respiratory therapists in your country, this is the best opportunity to fill out the survey. This survey will go a long way for us to see how the people of the country validates or want this profession to thrive or stay in their country. Can also reach us by visiting our website on www.africaresp.org. And also, if you have missed our previous episodes of webinars, you can reach us or you can watch it again on YouTube. That's Africa Respiratory Care Association. Just type Africa Respiratory Care Association on YouTube. You can watch all the webinars that you might have missed. And then you can also visit our LinkedIn, Facebook, Twitter, and Instagram pages as well.